we've given enough time for everybody to log on. I don't want to take up too much time. Oh, thank you. Also by a parent, Thobeka Mkumla, about the honest attention, that's often unspoken realities of parenting a child with autism went viral. It resonated with many caregivers and who navigate the daily balance between love and the exhaustion that comes with it. I tried to get in touch with her, but the post has since been deleted and this must have been deactivated, so I couldn't trace at all. But anyway, we're using her name. So April is also Autism Awareness Month. And so we thought it fitting to ride this hype after the TikTok and present this webinar. We wanted to create a space to unpack the lived experiences with empathy and insight and explore the emotional, physical, and psychological toll that caregiving can take. And so we invite you to join us as we move beyond awareness toward understanding, validation, and sustainable care for those who give so much. So we've invited Dawn, who is a researcher and very well versed in um, specializes in caregiver well-being for families of children with autism. Her work examines stress, coping, and the quality of life among caregivers, with an emphasis on the severity of a child's autism and the socioeconomic factors that shape caregiver outcomes. So, Dawn, over to you. Thank you so much for your
Thank
time.
you. Thank you so much for having me. And thank you all for joining. And I appreciate the opportunity to talk about autism. And I'm looking forward to the future discussion that we have on autism. Uh, this work, stress coping and quality of life of parents of children with autism, this specific study was my dissertation study and has recently been published in the Journal of Autism and Developmental Disorders. I have a few other studies going on, and maybe we can talk about that later. Next slide, please. So today I'm just going to talk about the autism landscape, the trends and the prevalence of autism, what caregiver stress means. I'm going to talk about this specific study, how I set this study up, what I measured in quality of life domains, and then the implications for families and also for policy and research. Next slide, please. So this is my why. I know we have several parents on the phone. This is my son. His name is Justin. And I have two children. He's my baby. He's my youngest at 25. He has profound autism, and profound autism is a subset of autism where these individuals are nonverbal or minimally verbal, where they need 24/7 around the clock care in order to do activities of daily living, like preparing their food or brushing their teeth or taking a bath. And then there's also an intellectual component where individuals with me and my husband, and we're very, very fortunate to have fought for services for him. It did not come easily. And we have a full-time caretaker in our home, and we have we live in the state of Florida, and we have state funding to help him. And I'll say that not everyone has that. So I know that we're very fortunate to have it. Right now he's stable, meaning his behaviors are managed with medicine, and I think he's got a low stress, not going to school or anything. And so we try to keep his stress minimal, and he's a really happy guy, and he's lovable. But he has in the past had severe challenging behaviors. And by challenging, I mean he can hit himself in the head. He has hit me several times. He's knocked holes in our walls. He's destroyed furniture. He's eloped. He's escaped from our home and gotten into swimming pools and lakes when he was younger. So he is a challenge, and I do understand and live the struggles of parents with autism. Right now, one of our biggest challenges is that my husband and I are aging and we have no long-term plan for him. So that's a concern for us. Next slide, please. So he is what I do, why I got into this research, and it is my passion project, like I said. I'm going to talk about prevalence where I am, and then I did add another slide just so that you guys know I'm sensitive to where I'm presenting to. But within the United States, our prevalence of autism is 1 in 31, primarily in boys. That has increased 5 times since 2000. So the year 2000, we had 1 in 150 cases of autism. And we're finding that the prevalence in girls is growing, but right now the prevalence is still over 3%, more over 3 times the amount boys versus girls. Next slide, please. And then I did some research, and this I cited for you all a recent study in 2024, where 1 to 2 out of 100 children has autism. And the time of diagnosis is between 18 to 24 months, which I would say is probably consistent with global statistics. And then 5 times more common in boys in your area, and then a 1.5% decrease, or 1.5 times increase in the rate of prevalence. So you can see that the trending part is consistent. And I'm doing global research. I get to present next week in Prague. I'm very excited. And I would say that trend globally is the same. The numbers might be different, but we do see that upward trend globally. Next slide, please. So what we tend to see in the United States is that there is a disproportionately affected population of minorities to us with autism, which shows that we need to work to do better, to identify autism earlier, to get services earlier, and to make sure that care is equitable among all children. Next slide, please. We can easily focus on the individual with autism, and sometimes caregivers come second to that, and say that can healthy mentally, physically, then they're not able to provide that care that they need, and we should look at care and quality family to thrive. Safe and mental health wise. Next slide, please. My study, and this is actually a framework from there were no frameworks specific to autism, but you'll see there are so many similarities, and we look at the caregivers' age, their education, the child's severity of the diagnosis, which I'm going to talk a little bit more about. That primary stressor, we usually talk about that as that's when your family member gets a diagnosis. So that's a big part in a caregiver's journey. That's sort of the moment that changes everything. And then you start to think about how you need to manage daily care, behaviors, what services do you need, what are your safety concerns, is your home safe for yourself and for the person you're caring for. And then mediating sources are coping. So how the caregiver is able to cope with a situation affects their quality of life, which affects the family's quality of life. And so making sure that the family has the tools that they need as far as education, and also making sure that they're confident in how they can manage the day-to-day caregiving and where they can find the resources that they need is really key to mediating that quality of life. And then as our outcomes, quality of life, this study particularly looked at physical health, psychological or mental health, and then the environment, which is safety and resources. Next slide, please. So I looked at those quality of life domains. I looked at coping self-efficacy to see if that was a mediator. And then I looked at, I did a statistical analysis to see if we could predict what predicts good quality of life and what predicts bad quality of life. Next slide, please. So this is a cross-sectional survey throughout the state of Florida. We have agencies for autism that are state funded, and they're located in 7 of the major universities within the state of Florida. So I enlisted them to help distribute my survey, and we surveyed parents of children aged 3 to 21. We got 152 responses, which is really, really good for a survey. And I had so many parents reach out to me and say, thank you so much for researching this. This is so very important, and we're so glad to get our story out. So if anyone's considering this line of research, I think you have no problem getting participants because everybody wants to tell their story. I did enlist a statistician, actually 2 statisticians. We did multiple regression models. We controlled for some of the demographic factors to make sure that the results that we had were really related to quality, the stress and coping to predict quality of life. Next slide, please. So these are the specific surveys that I used. And if anyone's interested later, you can email me and I can send you slides. But we won't go into them too much. I've talked about the measures. So next slide, please. So this is what I found in the demographics, that first survey. I sent the survey broadly, and I was hoping that mothers and fathers would participate. I got primarily mothers, and that is really consistent with the autism research. Moms carry the burden of caregiving for the most part within the population of autism and intellectual and developmental disabilities. And fathers are low to respond that fathers do not provide care. And I told you before, my husband, we partnered together to provide care for our son. Just the survey part, we just can't get them to fill out surveys. So we need to work on a way to get dad's voices heard. I looked at parents who had children aged 3 to 21, diverse income levels, diverse education backgrounds, and throughout the state of Florida. This, on the right-hand side of the slide, this levels of severity shows that the majority of participants were moderate in severity. And those level 1, 2, and 3, those are from the Diagnostic and Statistic Manual for criteria. And I will say the language in autism changes like weekly. So some people do not use severity or level 1, 2, 3, or mild, moderate, or high autism. And some people prefer high or low support needs. And so at the time of this survey, we were using level 1, 2, and 3. But I am sensitive to the fact that language is different for a lot of reasons. Next slide, please. So what I found was daily stressors can impact physical quality of life. So that means that these caregivers are going to have low energy, they're not going to sleep well, they may have chronic pain or mobility issues, they may have trouble performing their own activities of daily life, and it may affect work outside of the home. And I found what does help is coping self-efficacy. So having confidence in your ability to handle that, the day-to-day stress of being a caregiver. And then also income, which I'm sure everybody can agree. If you are flush with money and you are able to hire people to help you or able to get services that you need for your child, then you have greater quality of life in this realm anyway, caregiver. Next slide, please. And so for psychological stress, so this is our mental stress, we found that the daily stressors also were decreased. So where parents had more daily stressors, they had lower quality of life mentally. And that coping self-efficacy, again, was something that helps to increase mental quality of life in caregivers. Next slide, please. And then this last domain that was measured in this survey, again, increased coping self-efficacy and income, improved quality of life in the environmental domain. Environmental is safety and access to services. So where parents had more money and more confidence in their skills, they were able to seek out the help that they needed, which makes sense. And then the severity of the diagnosis is tied to profound autism. At the time I collected data, profound autism as a term did not exist. Profound autism is newer within the autism language through a Lancet Commission on Autism in 2022 and 23, and a definition by the Profound Autism Alliance. So greater severity of the diagnosis, kids who have bigger challenges, who aren't able to perform activities of daily living, this directly affects safety and environmental quality of life. Next slide, please. And this is just a summary slide that shows the last 3 slides, but it puts it all together. No single one factor affected a domain. So we looked at, when you do a regression model, you look at subsets or of several things together. So this was the report of that. And again, that coping self-efficacy, you can see on the second line, helps in every single domain for parental caregiver quality of life. Next slide, please. So this is the single strongest predictor. And this, the implications for this are that this is something that we can teach and we can help families. So where we can say you are confident, this is where you can get the resources, or we can teach them to better care for their child, whether it be activities of daily life, whether to seek services. These things are strongly related to quality of life across all domains. Next slide, please. With caregiver strain and safety and participation in family functioning, what we found overall with caregivers is that they have a greater incidence of having to worry about their child wandering, which leads to safety issues. Within the state of Florida, we have the largest number of drownings from children who wander from their home or from safe areas here. So the safety concerns are big where I am. We have a sense of danger. They'll worry. They'll wander into water. They have a propensity for water. It's very costly. You might have damage in your home and furniture destruction. They'll bear that burden. Next slide, please. So providers, and I'm a nurse and a nurse practitioner, but I don't think this limits to nursing. I think anyone who is in medicine or physical therapy or any other therapy where you're seeing a child with autism, you could take a minute to ask the caregiver how they're doing, or maybe provide some resources, or maybe you could teach some simple or where to effectively seek the resources that they need, or and you might not be the person to sit down with them and help them fill out paperwork, but maybe you know where they could go to get that help. And that would all boost these coping strategies. Connecting families with those resources that they need, and remembering that autism is not one size fits all. So there are different levels of autism. There are different behaviors within each individual. Every individual is different. Every family is going to look different. So tailoring the resources to that. And then some of the other things besides the financial support and the policies are to increase community services, particularly for countries like mine, where we have that minority population that is underserved, making sure that we have equitable services for everyone. If there are autism, if the individual is able to work outside of the home, if they have support for work, if they have transportation, anything that can make them successful in a community setting will benefit them, will benefit the whole family structure. And then research needs to be done on caregiver health. And sadly, right now, research funds are hard to get. And sometimes research money goes towards those really exciting technology projects. So if you have flashy technology and something exciting, people will throw money at you. But if you're going to talk to people about their feelings, people might not want to give you money, but it's still so very important. So I think just as a parent, getting your voice out there as much as you can, and then supporting researchers and supporting agencies that fund research that does look at caregiver health. Next slide, please. And so we need research on studies that can help boost that coping self-efficacy, because we know that that helps families. Longitudinal research, because my study was like a one-time study, but we need to look at over the years, what is the impact of caregiving over years? And does the caregiving quality of life change in a caregiver who's been a caregiver for 5 years versus someone who's been a caregiver for 30 years? And what we're seeing now without good housing is that these caregivers are caregivers for life. And so we're going to see those impacts. Diverse populations, development of technologies to support families and caregivers, and then just expanding policy, expanding financial support. for these families. Next slide, please. Thank you all so much. This is a full citation for my study and my contact information here at the University of Central Florida. And like I said, if anyone wants my slides anytime.
Thank you so much, Dawn,
Thank
for
you.
sharing your research as well as your story with us. You know, we're always told that the most meaningful research is initiated by what our passion is and our personal situations, and your work is commendable. Please stay on for a little while. There are some questions that I think will be very interesting for you to answer to compare, you know, low middle income country to what you have available. But thank you. In the meantime, we will ask Candace to put on her screen. Dr. Candace Hendricks is a senior lecturer at physiotherapy at the University of Cape Town. Has over a decade of academic, clinical, and leadership experience in higher education. She holds a PhD navigating the complexities of securing comprehensive assessment as well as referral pathways to specialized intervention for her son. Candace, thank you so much for sharing.
Good evening, everyone. Thank you so much, Roshaan, for the invitation. Are you able to hear me, firstly?
I am, yes.
Okay, wonderful. So thank you so much again for the introduction. And yeah, it's actually quite interesting to be sitting on the other side, being a parent and not sharing research like Dawn has just done. Thank you so much, Dawn, for that wonderful information. I think it's really valuable information. Anyone learning more about autism. And so I was actually very nervous to do this presentation, or at least just to share my experience this evening, when Dr. Salie had asked me. And I guess it's because you just don't know where to start. But I do know that I've got a time limit, and so I cannot obviously share everything. But I think the most important information that I would like to share with everyone is the difficult journeys that myself and my husband had experienced when our son was diagnosed. So we have a child, a boy. His name is Luca. He's currently 8 years old, and he is truly a joy to us. So he was born in 2017, had developed normal milestones all up to 2 years. Started speaking or saying single words, and even age of about 10 months. But as he grew older, he regressed in saying words, and ultimately he just didn't speak at all. And at the 2-year consultation with the pediatrician, we then obviously spoke to the pediatrician about our challenges with him, which we didn't really have much at the time, but our main concern was this regression in speech. And I think just with having that conversation with the pediatrician, they obviously screened for possible autism. And at the end of the conversation, the pediatrician basically told us, well, it sounds like Luca is on the spectrum, and I think it would be really valuable for once a year just to see how he develops. And that news was very shocking for the two of us to hear, because even though I am in the medical field as a physiotherapist, please understand that we have different fields in physiotherapy and chronic pain, and predominantly in the adult population. And so if I compare myself to Dr. Roshaan Salie, who is an expert in in pediatrics, she obviously has more experience working with kids. And so at that time, I did not have any experience working with kids, specifically kids with autism. I knew about the condition, but both my husband and we've never had been exposed to any family or friends, kids or children being on the spectrum. And so we didn't really know what to expect when we were informed that our child was on the spectrum. Um, what also was a bit of a disappointment at the time when we found out about his diagnosis was the fact that the pediatrician did not really share any information about how to navigate this journey. I live in Cape Town in South Africa, in the Western Cape in South Africa. And so we have a specific healthcare system. I went to the pediatrician in the private sector, and I was expecting the pediatrician to at least share some resources or some kind of information about how to navigate this journey with Luca. Who should I speak to next, for instance? How do I get my child into a special needs school? And if he ever needed to be in a needs school. And so that was a very confusing time for both myself and my husband. It left us asking a lot of questions, and we didn't really get any answers or any guidance from the pediatrician. I am still an academic teaching at the University of Cape Town, and, and I do work in a department, difficult time for us. This all had transpired in the time of COVID. COVID just started in 2020. And so contact sessions had placed Luca on a 9-month waiting period for an appointment. That's how we managed to get him through Red Cross. It was a very long wait. In this time, Luca had presented with more of the characteristics, if you can say, that would be classically featured in a child having autism. He was presenting with head banging at the time, which was probably the most difficult behavior for us to have experienced with him. However, when we took him to the pediatrician, he had reassured me that it was, just a way for him to seek that sense of head banging period didn't last too long though. My husband died. Long story short, I see Roshaan wanted to probably tell me Candace the time. Diagnosed at Red Cross at the age of 3 in 2021. He was diagnosed with profound autism as he was nonverbal and with intellectual disability. And he was then referred to the Western Cape Department of Education um, to be placed on a waiting list for him to have an assessment at a special needs, or to be placed at a special needs school. I'm fast tracking now. In 2023, attending Vera in 2024. He's been there for 3 years. And I want to just share with everyone that he is a very happy child at the school. It is his happy place. I have seen so much growth, so much development, and he has started saying words. And the first time that he's ever said mama was when he was 6 years old. And for many parents, mama is a word that gets said very frequently by a neurotypical child. But for us parents, we long to hear that word, mama, I love you, dada, I love you. And now he's saying it. The funny thing I want to add is that he doesn't just call me mama, he calls me Aunt Candace, because he hears all the cousins, all the friends calling Auntie Candace. So he says Auntie Candace as well. Um, there's such a lot to share. Webinar is about burnout of the caregiver. I have experienced it to the point where I had to be admitted to the clinic in 2022 and in 2023. I, I was admitted for 3 weeks at a time, and it wasn't like, it is really important to understand that caregivers go professionals that gives you coping strategies on how to handle the situation that you need to go back home to. And, and so yes, appreciate it.
Candace, with us. We wish you all the very best with Luca, who's being so loud, and we're so glad that I will. I see Nicolette has
Thank you
already
so
put her
much.
camera on. Thank you, Candace. Nicolette, the floor is yours.
Oh,
I'm Roshaan tonight. Good evening. Good evening, everyone. Thank you, everyone, for joining us tonight in on this very important conversation. I developed a bit of a tight chest, so please excuse me. Yeah, once again, thank you, Roshaan, for inviting us again to onto this one of your webinars. And I think it's very fitting to talk about this important topic. Thank you, Dr. Dawn and Candace, for your stories. We are all first and foremost parents here tonight, just sharing our experiences and our journeys. Our journeys is somewhat similar, but also different. Um, I am a mom. My name is Nicolette Repepi. I struggled a bit with my Zoom application this afternoon, and I asked Roshaan if she can just help me out. So yeah, so I'm on her link tonight. I am Nicolette Repepi. I'm a single mom to Tyler Repepi. He's a 21-year-old non-speaking autistic individual, a young man. Wow, he's a reason what I'm doing today. My background is not, I'm not, I am I trained management for many years, up until about 20 at the time. I did have a presentation, and I said to Roshaan, I think I'm just gonna speak from my head and from the heart, and because we're here to just speak about the journey and what really, how individual us as parents, family that care for not just the autistic community or an autistic, that requires it can be our parents, it can be a sister. I'm the youngest of had an intellectual disability. He since passed away about 12, 13 years ago. So I grew up also with a single mother. My father died I was very young. I was 6 years old, and he died of cancer at the time. So I grew, and I don't want to go into that too much. I just want to give some background, and also raised by a mother that did everything in her power to care for 6 children. Single, she never, 4 of us as daughters, and 2 boys, my brothers, in 2020. And fast forward, I am a single mother because my children's father passed away. It's now 10 years later. And Tyler was diagnosed at the tender age of 2.5 years old back in 2007. He'll be 22 years old this year. And my mission and the work that I do was shaped by Tori. It was really challenging. I had a job, a career in corporate, which I thrived in, and I enjoyed it. And my background is procurement and in commercial services, accounts verification, the whole package. Dr. Dawn shared earlier in her presentation, and it's so informative. Just, Cape Town, grew up on the Cape Flats in Mitchell's Plain, and I live in the Strandfontein area now, and that's also where I work, and the work that we do with the organization that was established 13 years ago, through the life of Tyler, Autism Connect. We work with young autistic children. We have an early learning center, children newly diagnosed between the ages of 3. Developed a skills and coaching center, shared on this platform with Dr. Roshaan on the transitioning from your childhood to adolescence and adults, who and that was also quite a profound session that we had. So I see we have some of our parents from Autism Clinic that is joining us here tonight, and I'm glad that they could make it from. It's very tough to manage, um, especially when you're alone. For me, and it still is, it's challenging, but by God's grace, I managed to do the best that I can with the support that I have. I have a 25-year-old daughter that is my great support. And I think the story, like Dr. Roshaan said, I didn't get to see the viral video from the mom that shared it. She just gave me a brief insider when we made contact, but it's real. We do need the support of our community, of our family. The impact of it is, and again, I said every family, it affects each and each one of us as a family unit differently, because it comes with finances that not all of us can manage, and especially when you are a single parent, to manage the spectrum, because it comes with significant expenses to have your child in a suitable place, facility, a care center, such as the likes of Autism Connect, or other centers that I am very aware and work closely with. To get the right support for our families and for our children, mentally, psychologically, it takes a toll. I'm not going to sit here and make as if I have it all together, and especially when you are alone. I really want to emphasize that a support structure in terms of support groups and just a support community is essential in this type of journey that we walk. Dr. Dawn shared earlier about her son. I could relate, because Tyler is on that same level, just for understanding that he still needs significant support. And many of our young adults that we work with at our skill center, and even at our early learning center, is the clients that we service. The reality is that support is there. There are many organizations, institutions, and facilities that provide support for autistic individuals or children or young adults with special needs. But it comes with a set criteria. And I was very intentional over the years when we've developed our programs and our support for this community, because I was first and foremost a parent that was denied access from very early, when Tyler was not initially integrated or supported into the schooling system. And Candace shared earlier where her son is at the Vera schools. And today I work with these professionals where they do the referrals to Autism Connect Care Center. It's a bit of a taboo now if we have some of our educational professionals here, that there is still criterion. Some of our individuals are our children, especially, to get them into the schooling system, and eventually when they move out of school, to get them into, and Shamima, I see your comment. yeah, the Western Cape is not geared yet for the support that we need in terms of respite care. There are centers, but it's very minimal. There's a big need, and there isn't much support yet for respite care, and that is so needed. We need that time to, as parents and as caregivers for our children, and the children that we work with, that respite care services is it's a need. And I work closely with the Department of Social Development. It is an area that is, or a conversation that's always brought up in the meetings that I do attend, but there's still work to be done. So I just meaningful parental support through access to respite care, counseling, peer support networks, skills development, coaching centers such as the Autism Connect Center that I work with. Um, it's really not a luxury. It's a need. It's essential for our children, for our community, um, and to strengthen families through a holistic and compassionate support system. Not only safeguards us as caregivers and as parents, our well-being is essential, and it directly enhances the development outcomes and quality of life for our children, and our families overall on the spectrum. I think we are out of time. There's a lot that I can share, with Dr. Roshaan, that she can share with the participants here tonight. Um, we need a support. We need to get together as parents, and we can share the support and resources. There is a wealth of information out there. There's a national body, the Autism South Africa, which is the body that renders support in terms of education, in terms of advocacy for the autistic community and the special needs community nationally. I do serve on that board as well. Connect people and connect with us. There's Dr. Candice, she shared earlier, just the team that she's fortunate to work with, that we can share resources and information with, in terms of just sharing and supporting people, and that we can just gear people to the right support networks. That sometimes it is hard, and when you hear and you see these videos, you see a lot of it on TikTok. It hits you hard, especially because we also have first-hand experience of working for our children, and working with the individuals. For me, I just want to say in closing, it's sometimes very tough. I am, I have a personal that I can't share just yet. Something that has happened with personally, and I've really had to take a step back, because working in the space consumes you so much, because it's a lot that I myself personally have to manage, um, to care for my family, to care for my children, to run this organization optimally. It's not a small organization. We have a staff complement of 14 people. Might seem small, but it's big. We have families that we are accountable to. We are accountable to government that comes with policies and governance and service delivery expectations. Last week we came out of a 3-day intensive monitoring and evaluation at our centers. So it comes with a lot, and sometimes you've got to step back and look after yourself. I realize, and someone told me today, you are being shut off and down. I'm right now off work at the moment. Because I really had to. I struggle personally just to cut off, but it's important. I realize if I don't look after myself, there is nobody for Tyler, and he is the heart. He is the reason why I do what I do, and I need to be care for myself so that I can care well for him because he needs me. It's not a burden that I particularly can lay on my daughter. She loves her brother so much, and yeah, so I just want to say in closing, when families are supported, informed, and understood, the entire trajectory of the autism community and the individual's life can change. I am, I just need some time and to rest and reset. This is a calling and it's not a job. I never see it. I always say to our staff, yes, it's a job for many because you are here, you get paid. But when you step in, we are positioned to work with other people's children and young adults and each and every one from the early learning center. Every child is my child. It's our children. Our young adults, it's tough at the best of times. We go through really tough times, but I always say I look at them as if they are my own. So with that, I want to say thank you for the opportunity. I hope I did justice, Roshaan, to this conversation. Um, yeah, so thank you.
Yeah, thank you so much, Nicolette, for offering your time again. I didn't say that you were the founder and CEO of Autism Connect, and this was also started because it's a labor of love for you. And so we
Yes,
thank you for offering yourself and your time to start this center, not only as for those who are transitioning into adulthood, but also starting that early learning center that you
yeah,
alluded to. There are a couple of questions that I think maybe I know that the time is already over, and so
yeah.
those of you who want to leave, please feel free to do so. Firstly, one thing, apologies for the stopping and starting of the recording. It was just an internet problem with our administrator. And then, if I can just read some of the questions, and I think it's quite interesting. Somebody was asking, is there any scientific evidence that the role of diet, supplements, or microplastics can play in children with autism?
Um, I'm just gonna comment on that. I'm not a professional in that, and that's a very good question. Diet is important. If I wish I did invite my nutritionist friend Janine. She's an expert, also a mom of a 19-year-old autistic young adult. And we just had a mini symposium this past weekend. It was just profound, the people that were on that, the lineup of speakers. So she would have been able to share that information, like scientific information of the link of the gut and the brain and the body, the all of that, and she's well versed in it. So I know also if Tyler doesn't eat well, and I don't particularly follow a very strict diet routine with Tyler, but if I do, and we are working towards that, you can see the difference. So, diet is important. And I wish she could be here tonight and maybe just share. But I mean, it's a conversation that we can definitely bring on board again, sometime.
Would you like to add anything, Dawn or Candace?
Sure, I'll add. I agree with Nicolette as far as being a mom and seeing when my son is eating healthy and good food, which
Yeah.
is not always his preferred choice. He likes snack food. then at least because he's a young adult, and
And we all do.
yeah, we all do. The science shows that diet does not affect the diagnosis of autism. What I think is lacking is how diet affects behavior, which probably goes along with what Nicolette and I are saying. And then we say sort of anecdotally, which means there's no research to back it up, but parents know when our kids eat better, they act better because they
Yeah.
probably feel better.
Yeah. I think tying into that is also a question of will it be helpful to give your child a calm med when they are starting to tantrum?
To give them a what? I'm sorry.
A calm med. It's a tablet that kind of
Oh,
calms you down. I don't know if you have that over there, but it's something that we use here in Cape Town.
I would have to research it. I don't know if maybe Nicolette or
So,
Candace.
yeah, so if I can just say, Dr. Dawn Roshaan, many parents do medicate just to calm them, and a child is having a meltdown, or we don't, in our terms, we try not to use a tantrum because a meltdown is behavior, if you have a non-speaking, non-verbal child that doesn't have a reliable means of communication in terms of any AAC device, or the child is just not able to express his or her needs or wants. So that happens. Um, I do find with my son, Tyler's on a risperidone, so it's a very mild dosage, and it just helps him because he's got autism comes with a friend, as we say it always, Dr. Dawn, it comes with your intellectual disability. Tyler has ADHD and all of that. So that just helps him to just manage it, in terms of his day. So comments I will use when I really feel a bit overwhelmed and I just need to tone down a bit. It's not something I particularly give him. Again, my friend that is in the health space and nutrition, she works with some really healthy, clean products, which I also make use of. Yeah, so that can be. It depends on the need at the time, severity, and again, I'm not a health practitioner, but parents do use medication.
Yes,
And
I
it
would.
and with us here, Dr. Dawn, it's like mostly, even with some of our children at our centers, it's either a risperidone concerta or it's Ritalin, and it just helps
Mhm.
them to cope during the day.
Yes, I would say that I looked up Calm Aid, so an over-the-counter like herbal lavender, I
Yeah.
think is what I saw. Uh, all children are different, and all levels of autism are different, and so probably the most safe answer is to tell everyone to check with your pediatrician or your family
Yes,
doctor to see what's right for your child. But it's very, very common to have those antipsychotic medications like Risperidone or Concerta.
yes,
My son has been on several in his journey, and now we have a little bit stronger medicine for like if we're taking him on a long car ride, we do use medicine, but every
yeah.
child's going to be different, and so uh, just be careful with over the counters. They may be right, but discuss it with your physician.
I agree. You've
Yeah.
got to consult your doctor.
Mhm.
I mean, he sees his doctor every 3 months, so it's not something that I just do out of my own will. Yeah,
Yeah.
so
Yeah.
that's important.
Yes.
Okay, there's several questions, but we can't answer all. And so I
Yeah,
think, Nicolette, what we can do is, can they get hold of you through Autism Connect? And you
yes.
have a Facebook page and an Instagram account, so they can get hold of you. So there's a lot of support questions and support systems needed.
Yeah, so I can share with Dr. Roshaan.
Can you put it
Sorry,
in the
I'm
chat?
trying
Can you
to
just put it
type
in the
my.
chat? Yeah.
Yeah,
Oh, sorry.
I'm gonna put it in the chat, and you've got all my details as well. And
Yes.
Autism Connect, we are sorry, we are live on all the social media platforms, TikTok, Facebook, Instagram. I don't know what else. I think there's more, but just search Autism Connect. There's an Autism Connect Early Learning Center, and we have the Autism Connect Skills and Coaching Center. So yeah, just search for it, and we are very active on TikTok as well. And my contact details is I'm gonna put it in the chat.
Thank you so much. While you're putting that in, I don't know if you can answer this, Dawn. There's a question about screen time and the effect that has on
Okay.
a child with autism?
Specifically with autism, I don't know. I know that in pediatric screen time is the recommendations are to limit screen time. I don't know of any studies specifically in autism. I will say that it's a challenge to limit screen time when the iPad is a communication device, and also when the iPad is like a source of entertainment and also kind of a comfort source for the parents. And so my personal philosophy on screen time is whatever's right for our family. But there is no science that I know of in autism and screen time.
Okay, cool. Yeah, so I think Nicolette's put that up in the chat there for us. So anybody can get hold of her. But yeah, I think that's it for us. Thank you again so much for your time, Dawn. We know that it's a time difference and everything, but we really do appreciate that you took this time out
Yes.
to share your with us.
Thank you.
And yeah, so thank you all, everybody, for your participation.
Thank you. Thank you so much for having me. I wish I could give a big hug to all the parents and especially the
Sorry
autism
about that.
parents.
Thank you so
Sorry,
much,
something happened.
everyone.
No, thank you
you.
guys. Good
Thank you.
evening.